Hello, welcome to the Pilling for Life presentation. My name is Christine King. I am a registered nurse at the Luke Weathers Jr. VA Center in Memphis, Tennessee. I have developed the Pilling for Life program. I am here today to give an introduction to this program and how it impacts our veterans and their health. I had an exciting time researching this program. Finding all the evidence based practice to go along with it. And I hope others will be inspired to institute it in other areas within different patient populations, not only within our VA, but within the VISN and throughout. Just wherever it's applicable in other dialysis centers or just with the elderly, because this is all about the elderly and frail. It helps reduce frailty. So let me tell you a little bit about the Pedaling for Life program. I'll just read what's on the slide here at first. It is a newly established exercise program for the dialysis unit here at Lieutenant Colonel Luke Weathers Junior Hospital, Memphis, Tennessee. We are very proud to offer this program to our dialysis patients. It has really made a difference. Pedaling for Life allows our patients to improve their overall health while enabling us to establish a long lasting relationship with them. Pedaling for Life's goal is to assist patients in living longer, healthier, more purposeful life. The program also increases physical and mental health, as well as improves our medical outcomes for our veterans. I am the nurse coordinator for the program. After researching intradialytic exercise, I found a vast amount of evidence-based practice that supported that there was a true benefit for our veterans. Evaluations are done for the program in a manner that is easy for nursing to evaluate. Physical therapy, occupational therapy, or kinesiotherapy can also perform these evaluations if there is a desire or a need for other strengthening to happen as well, and not just the pedaling during the program, which we have chosen to do to get involved with kinesiotherapy on this endeavor. So our objectives for this class is to define frailty. We're going to identify the risk associated with frailty in stage renal disease and in geriatrics overall. We'll define SPICES, that is an acronym, along with the symptoms that are observed in the elderly. Establish common diagnoses associated with age and frailty. Discuss the significant role of Pedaling for Life in intervening with aging characteristics. Discuss evaluation measures for progress with Pedaling for Life, and identify how Pedaling for Life can drastically improve staff and veteran relationships. Okay, so first to let's define what we are fighting against. We are fighting against frailty, right? And this exists in most our veteran population. Frailty is defined by Sexton and Spiro as characteristics by physiological decline in multiple systems resulting in diminished muscle strength, decreased endurance, and unintentional loss of emotional, social, and spiritual impacts. This defines and impacts many of our veterans because most of our veteran age are frail, they're older. Um, they come in, they have, it impacts them, it impacts their families, it impacts their loved ones, and often there's a feeling of loss by the veteran, which does cause an emotional impact as they lose function and ability. These emotions are often expressed inappropriately. They can lead to increased isolation, impacting their social life. Emotional and social isolation can lead to decreased spirituality. So this is why it impacts all of these aspects. The circle continues back around with emotional strain and even more social isolation most times. And so even if they do have a support system, they unintentionally can often isolate themselves. Okay, So let's discuss about the many high risks that are associated in our veteran population. So with ours specifically, there is frailty with the end-stage renal disease and their age that impacts everything. This leads to a lack of compensatory mechanisms, acute infection opportunities, with decreased response to those infection opportunities, hospitalizations, emotional effects, and ultimately increased mortality and morbidity. Uh, any of these can be exchanged in the cycle. So um, the veteran might experience a hospitalization, which leads to emotional effects, which is more stress on the body, acute infection, and therefore increased mortality and morbidity. Or the veteran might experience an emotional crisis and be hospitalized from an emotional crisis, and that increases their frailty, which increase mortality and morbidity, putting them at risk for an acute infection. The Pedaling for Life program can reduce one of these modifiable aspects, which is the frailty, and it has a big impact. Once our patients are in end-stage renal disease, they are where they are, they're on dialysis, and we can't modify their age, but we can assist in their frailty, which will help their body overall become stronger, give them a sense of encouragement and positiveness about their body image, which they often, experience not only with aging, but with end-stage renal disease. So let's talk a little bit about our geriatric assessment. There is an acronym used called SPICES, SPICES. Um, this defines the common symptoms associated in the elderly and with frailty. S is for sleeping disorders. And again, all these are interrelated. They possibly exist by themselves. They might have one of these problems. They might have a few of these problems. They might have all these problems. So this is a very impactful assessment for our veterans. P is for problems with eating or feeding. This can be due to lack of finances, inability to prepare food, lack of transportation, as many, many, many of our veterans have. I is for incontinence. C is for confusion. Once again, confusion could be the cause of the problem associated with other symptoms, or it can be just the problem itself. E is for evidence of falls. We may see bruising or fractures, even weakness can be, the evidence that we see or triggers us on our fall assessment. And the last is for S for skin breakdown. So we have sleep disorders, problem with eating and feeding, incontinence, confusion, evidence of falls, and skin breakdown. How many of these symptoms can we correlate to veterans, to our veteran population? The Pelling Per Life program promotes sleep. It appetite as they exercise, they're hungrier. It reduces falls because it increases strength and mobility. Um, and therefore, if they're more mobile and they have more strength, they're able to either change themselves on a regular or possibly make it to the restroom when they couldn't before. And this overall decreases skin breakdown. Here are a few common diagnoses associated with age and frailty. You have fatigue, you have hypoalbumin, which is low albumin protein, cognitive decline, inflammation, failure to thrive, and loss of muscle tone. And once again, these symptoms can exist independently or together. They can cause each other or exist by themselves. And many of our veterans are facing one or all of these symptoms. The Pedaling for Life program can decrease, improve, or eliminate one or more of these symptoms. Again, it was why it's such a good program and easy to institute in a facility. Again, because it increases muscle mass, it increases circulation, promotes sleep, decreasing inflammation by increasing muscle mass and circulation, promotes increased appetite, which equals protein intake, which would fix that low albumin. All the diagnoses can promote, or prevent the cognitive decline. As they stay more fit, they stay more interactive as they're there, as they're working with us, as they're pedaling. They interact with us, and that keeps them, they're cognitive, very sharp, and keeps them very, very on their toes. Okay, so this slide shows how Pedaling for Life program can intertwine with every aspect of aging characteristics, right? The diagram, following the arrows up and down, shows how also the aging characteristics impact each other. Okay, let's follow the arrows upwards. Here we go. We have the disease process, and that leads to medications, which leads to physical, cognitive declines, maybe appetite changes from either nausea or um, just fatigue from the new medication. Sometimes blood pressure medications can cause that. Um, these lead to frailty. Okay, and then we have, with the frailty, we have increased falls, mental strain, stress, and possibly hospitalization, which overall increases mortality and morbidity. And then we insert our Pedaling for Life program. Um, and it can either slow or even eliminate some of these disease processes and characteristics of aging. Okay, let's follow the arrows downwards now. So you have the Pedaling for Life program, which decreases mortality and morbidity, which can impact falls, mental strain, stress, and hospitalizations, which it improves frailty in our elderly. Therefore, they have better physical, better cognitive, better appetite because they're exercising, all the things that, exercise does, decreased medications, and therefore, overall disease process and prognosis and medical outcomes are improved. So, how do we measure their success in the program? So, the CDC offers two easily accessible measuring tools: the sit to stand and the time up and go. These are the ones that I found mostly in the studies, that are most relevant and easily measured. Nursing can do these. Like I said, you don't have to necessarily institute this program with all factors involved as far as physical therapy, kinesiotherapy, things like that. Nursing can actually do these tests. They're very easily. So the sit to stand, patient just sits down in the chair, crosses their hands across their chest, and sits and stands as many times as they can in a 30-second window. As they increase strength and their endurance, this time increases. The more reps they can do, they can sit to stand more times within that 30-second window. The other one is a time up and go. It is just as easy. Patient sits in the chair, they start a timer, they stand up, walk 10 feet, turn around at a regular pace, and return to the chair. And then you time. And as they improve with this program and build with this program, build their strength, their endurance, their muscle mass, get rid of more waste, this time up and go will decrease as well. They'll get quicker at getting up and walking the 10 feet and returning to the chair. We are having kinesiotherapy perform these tests because we are also doing upper body strengthening with their non-dialysis arm. They are using bands to strengthen, their upper extremity as well. Also promoting, increased calorie burnage and use, more muscle mass, which again gets the albumin, that protein, that their appetite, more overall, more strength. They feel better about themselves. They're like, man, I'm looking good. So this is Pedaling for Life in action. These are actual pictures of some of our patients and our kinesiotherapists working with the patients. We are right there with our veterans. Many of our nurses are at the desk doing the peddlers themselves, in support of the patients and improving their health and their outcomes, medical outcomes as well. They see us participating, and we're just in it with them, right? All the way. We're building confidence with them and their confidence in our staff because we have a team approach, right? It's us and them trying to improve their health. I provide education updates on their improved scores. They get a monthly letter stating how their scores improved as far as their resistance level on the peddler, their time on the peddler, how their distance on the peddler. So we, like I said, uplift and encourage. Um, we build confidence, uh, education. We educate them on how this can work for them. And again, on just those good foods, we also have nutrition involved who see our patients and recommend on their labs, their monthly labs of their protein intake and this and that. Our patients specifically, their phosphorus levels and all that they should be monitoring. Um, and then it gives everybody a chance to interact with the veterans, right? To have this increased patient satisfaction that comes along with feeling like they're part of a team and that they are, we are in this together and we are here to serve them because they have served our country. These are the references listed. If there are any questions, I'll be happy to answer them at the end of the presentation. Thank you.